Thank you. So I'm Amy.
And I'm Debbie.
We'll just share our slides, so just bear with us. Can you see those?
Yes, we can.
Yeah.
Thank you.
Thank you, sorry. Okay, so we're both physiotherapists and we work at the Baines Community Hospitals. So this is our presentation on the Cubii project. So the Cubii machine is a seated exercise machine, which you can see from the pictures there on the slide. So Cubii is the brand name. And the first model, which is the black and purple one on the left, is what we first used as part of this project. And then the grey and orange came next. And then we've now got the grey and blue ones that we're using on the ward. So this project was a way for us to increase the amount of strength exercise taking place on the inpatient units. So we've got two wards in Bath and North East Somerset. One ward has 29 beds and the other ward has 28 beds. We take our admissions directly from the acute hospitals, such as the RUH or Southmead in Bristol, for patients that need a step-down bed and some rehabilitation. Or we can also take patients directly from the community as a step-up and a place of safety for some rehabilitation as well. So we've noticed, and there's lots of evidence out there, that patients spend a lot of time being sedentary in hospital, either led in their bed for long periods or sat in chairs. And we wanted to do something about this, which is kind of how this project first came about in 2023. So there's one research paper that shows that patients are spending up to 23 hours of the day doing very, very little, and just 1 hour where they're actually being active, whether that's standing, walking, transferring. We also know that the harms of deconditioning are accelerated in older people, and up to 60% of older adults will experience a functional decline after a stay in hospital. So this project aimed to turn all of that around. We wanted to increase the amount of physical activity that was taking place on our units. We wanted to get more people involved in strength training and resistance-based training. And ultimately the aim was to prevent hospital-acquired deconditioning. So some of the evidence, there's lots out there that you can go and read around deconditioning. And this is a topic that's becoming more and more researched. So the international exercise recommendations in older adults is a consensus of experts in the field. And they say that exercise and resistance training are especially important to minimise deconditioning, and that they should be performed daily if the patient's medical condition allows until discharge. So that's the recommendation for any adult in hospital. Klempel et al. Looked at the effect of chair-based exercise on physical function in older adults and found that it was a safe and progressive way to exercise, ideal for those who are particularly frail or deconditioned. And that's what our patient group are. Most of them are over 65. They spent a lot of time in the acute hospitals, not doing very much by the time they get to us. They are really quite deconditioned. That research paper also said that health services should be reinforcing the message that every minute of physical activity counts. And that's what we found we've really been able to do by having the Cubies on the ward. It's a visual reminder to patients, staff, visitors, the importance of exercise, and this is the way that they can get involved in their rehab.
So why a Cubii? If you look at the pictures on the screen, you're probably very familiar with the stick-like pedals that aren't very useful, aren't very good, move around, not really fit for purpose. So if you look at the Cubii on the right, it's very substantial, it's not flimsy. We found that it was cost effective, it was portable to be used on the ward, easy to move from patient to patient around the ward. It's a low impact exercise, accessible for the majority of patients, and it didn't need an electric supply, so that was important on the ward. So Amy applied for funding through the Difference Grant, and 6 machines were purchased initially. We started the project on one ward in August 2023, and a month later on the other ward. We staggered the start to get us on our feet. We started small, ironed out a few teething problems, and then scaled up the project. We formed a patient eligibility criteria for using the Cubii machines, asking if a patient could sit out safely in a chair, if they could weight bear through both legs, could they consent to exercise, and could they follow simple instructions such as remaining sat down whilst using the machine. If a patient was not able to use the Cubii machine unsupervised, it didn't exclude them. It meant that we had to adapt with either staff, family, or volunteers supervising them while they used it. We agreed outcome measures and collected our data. So the impact of the project. So this graph shows the monthly totals of extra exercise in addition to what we would usually be able to offer over both of the wards. As you can see, there's a general trend upwards, and that trend has continued over the 12 months of the data collection. Our record month has been August 2024, where 174 hours of exercise were achieved across both community hospital wards. From our first month in August 2023, compared to a year later, August 24, we've seen an increase of 8,597 minutes of exercise. This shows that the machines are now embedded on the ward as part of our daily care, and they continue to be well used by our patients.
So one of our outcome measures was a 5-minute test. So on a patient's first go, after their admission to the ward, we recorded how far that they could pedal for 5 minutes on level 1. And then we repeated this test on their last go before their discharge. And then we compared these two scores. So we were able to get 86 patients completing the admission and discharge 5-minute test within the first 3 months of our project. And therefore the comparison is on that pie chart. So 71% of patients saw an increase. So we're able to pedal for more strides within those 5 minutes, and 11.6% stayed the same. The 17.4 that decreased was only a decrease of 7 or 12 strides, so not by a massive amount, but a decrease nonetheless. We had more patients taking part in the Cubii project within the first 3 months than those 86 tests reflect. However, not everybody completed their discharge test, so we weren't able to include them in this outcome measure. And some of the reasons were because somebody might have become too unwell and got readmitted to the acute hospital. Some other of our patients became palliative comfort care, so it wasn't appropriate. And a couple of times patients declined to do it for various reasons before they left the ward, so we weren't able to capture their data. Another outcome measure that we used was patient feedback. So we designed a questionnaire that had 4 questions, so really simple for our patients to fill in. And they were given this on their last go before discharge. So question 1 was on a scale of 1 to 10, how much did you enjoy using the Cubii machines? And we got 79 questionnaires completed within our first 3 months. And the average score was 8 out of 10. So they were well liked on the ward by our patients. Question 2 asked the patients to give the reasons for their score in question 1, so we could get some more qualitative comments. So one of the patients said that they really enjoyed it, it was very good for their legs, and it made them feel they were doing something worthwhile, which was really important for us because as part of their rehabilitation, we want to engage them and get them on board doing their exercises and actually participating in physio. Another patient made comment that they were going to go and buy one after discharge. And they really liked that they could self-regulate how hard they work. So the machines have a resistance level from 1 to 8, and the newer machines have it from 1 to 10. So the patient can progress, start on level 1, see how long they can go, and then either build up the time that they're pedaling for or the resistance. And so they can work through the levels during their time here as they get stronger. So that's really nice that it's progressive. And another patient said that it was just the right pressure for them and they found it relaxing, which is nice that they are enjoying the exercise and actually found something that they want to take part in. And we often have patients asking to go on those machines, can I have those pedals as part of their daily care now, which is a really big change for us on the wards.
So this slide shows the feedback from questions 3 and 4 from the questionnaire. And as you can see, 96.2% of patients agreed that if they were in hospital again, they'd use the machines. And the same number agreed that having the machines in hospital is beneficial for patients. This shows that the patients like the machines and they would definitely use them again.
Another outcome measure that we used was staff feedback. So As well as the patients liking the machines, we wanted to make sure that the staff were on board with using them as part of a patient's daily care. So we sent out an email link. It was on SurveyMonkey, so it was anonymous, and we were able to get some really honest feedback from our staff. So one staff member said that they liked that they were able to provide physical activity to multiple patients at the same time. So often on the ward, you'll have a few patients sat next to each other. You can take a machine to each of them, and then they're exercising, pedaling away, and then you can go and see another patient to do another treatment session, and then go back and check on those patients a little while later. So we were getting a lot more exercise without having to increase our staffing levels, which was really important when we're in a climate there's no more money for any additional staff on the ward. Another staff member, said that it was good that it was focused on muscular strength, and that's linking back to that resistance element. So we often see patients getting up to level 4, level 5 within just a couple of weeks of having a go and using them consistently. Another staff member commented that they were quick and easy to use. So we created a documentation system where we had a daily log that you would fill in, and then you could fill in a sticker that goes directly in the patient's notes. We're still using paper notes on our wards, so we have to document everything by hand rather than electronically. So we would fill in the log, which took 10-15 seconds, patient initials, how far they cycled, and the strides, and then that information was put on a sticker and stuck in the notes. So it didn't really ask the staff to increase any extra. Really busy on the wards, and you need to make sure that information is documented. And finally, a staff member commented on the social aspect, which is really important. So we set patients up, and often they're next to somebody else having a go, and so they're either competing against each other or they're competing against themselves to try and beat their last score. And they're having a chat whilst they're doing it. So there's the social and the mental aspects and the benefits of the exercise, as well as the physical strengthening that you initially think of. So we thought it'd be good to reflect on our learning from this project. So first of all, we've identified a way to increase patient activity and resistance training within our 2 community hospital wards. We've managed to create a sustainable change, and the project has continued to grow each month. We found a simple, progressive, chair-based strengthening exercise that many patients are keen to engage with whilst they're in hospital. And this really does help to reduce the sedentary behaviours that you see, and that goes in hand with preventing deconditioning. And we've done all of this without increasing any therapy or nursing staff on the ward. The machines are cost effective. So we got our first ones, which were the black and purple ones, for just over £100 each. And now the newer models are available for £269, which is cost effective when you look at how many hours and how many different patients are using them every day. We've been efficient in the way that we've worked. We've implemented that quick and easy documentation system through using the stickers for the patient's notes and just a really easy daily log for the daily data collection.
So for the next steps, we've now trained most of our nursing colleagues, and the Cubies are being used on the weekends. We also implemented a kind of a competition. So between the therapists, it was kind of bragging rights to who used the Cubie the most. Amongst the HCAs and the nurses, there was a voucher, only a small value voucher, but a voucher for who managed to get the most patients on and use the Cubie on in a month. So that was good to get involvement from the nursing staff. We've shared our results wider, with Amy presenting at the Recondition the Nation forum. We shared what we've been doing at a recent HCRG Physio Away Day, and we are now looking to expand within HCRG with other teams making purchases, such as the community respiratory and heart failure teams. We're also pleased to report that some of our patients and even visitors have gone on to purchase a Cubii to use in their own homes, and this will continue to reduce sedentary behaviour, helping to keep people more active at home. We're having discussions with Performance Health, who now own Cubii, about how we can expand the projects across the UK. The vision being having a Cubii on every ward, in every hospital, everywhere. So in October last year, we won the Community Hospitals Association Award for Innovation and Best Practice. At this year's conference, we will be presenting our own Cubii workshop. Thank you for listening. We're happy to answer any of your questions.